Good afternoon, everyone. Uh, Today, we are going to talk about managing chronic mental illness during COVID-19 pandemic. If the panelists can please mute yourself. Thank you. Patients Engage, for all of you who don't know, is an online platform focused on holistic and evidence-based management of chronic conditions from the perspective of persons with chronic conditions and their family caregivers. We strongly believe in the value of lived experiences and how being informed and being engaged and proactive about your own health leads to better quality of life. And as part of that, we have been putting out content which helps people, learn about various conditions as well as how to manage. And for the last, also been doing webinars. And for the last 2 months, we've been doing a series around how to handle COVID-19 situation. So whether it was the initial lockdown, which caused a lot of, you know, uh, issues like unavailability of medicines, issues about not being able to reach the doctors, and so on. To as the lockdown extended, there were issues about people feeling anxious, people having panic attacks, wondering about how their jobs will survive or not, and so on. So as part of that, and these are some of the webinars we have done on that on the mental health topic. And today we are talking specifically around managing chronic mental illnesses, especially conditions like schizophrenia and bipolar, or any other acute illnesses during the COVID-19 pandemic. We are very privileged to have with us a panel which is very wide ranging. So we have Vijay Nallawala, who is a person who lives with bipolar and is founder of Bipolar India. We have Mr. Mokashi, who's a father of a son who lives with schizophrenia. Vidya has a sister who lives with schizophrenia. And we have two psychologists and counselors, P. Karpagavalli from SCARF Chennai, and Kadambari, who is also trying to be an arts-based therapist learning at the moment, who works with Schizophrenia Awareness Association in Pune. And we have with us Dr. Mangala from SCARF, who's a consultant psychiatrist. And I'm Aparna, I'm the moderator for this for this webinar. So quick guidance, this does not replace personal consultation, so please consult your doctors, your counselors, etc. This session is being recorded, so if you're logged into Zoom, please post your questions on the chat. If you're on Facebook, on the Patients Engage page, you can post your questions there. We will be taking questions from the live feed as well. And we are on all the significant social media platforms, and the recordings of the webinars go up there. So let me stop the share and get started with the discussion. So let me start with Vijay, who, as I said, is a user survivor. Vijay, what were the changes you had to make to your routine, and how did that impact your health? You're on mute, Vijay. You're on mute.
Good afternoon, everybody, and thank you, Aparna, for having me here. A very good afternoon to all the panelists also. I think the biggest impact was when the whole thing hit us, the initial phase. The adjustments were the toughest to make when we are trying to grapple with the abrupt changes which were forced onto us. So, I mean, initially, of course, the amount of fear around it, the uncertainty about how the virus affects us, the precautions we needed to take, and when your routine is suddenly disrupted, it takes a little time to adjust to the new set of circumstances. So I found I think the initial fortnight of the lockdown, or maybe 3 weeks of the lockdown, a bit challenging. Yeah.
Right.
But having said that, my long journey of living with bipolar disorder has made me very resilient. And in a way, I don't think I was as affected as some of the other members of our community would have been, right? And to give you specific examples, people living with bipolar disorder would prefer to maintain a strict schedule. Okay, I mean that is one thing which they try to do to ensure that their moods are in check, and they are comfortable with what they're doing. To so sort of a follow a routine which they are very accustomed to. Now, with COVID and the pandemic and the lockdown in place, those things were thrown out of the window. So, for instance, I'm an avid gym person, every day, the morning workouts of 1 hour, socializing with my buddies at the gym, that sort of eggs me up, So this was suddenly taken out from the schedule, right?
Right.
Find that I could replace that with workouts at home, but that's not the same thing. On the health front, now you can't do one-on-one consultations with your doctors or psychologists in person. That has to be replaced by telemedicine during these times. For instance, as recently as last week, I had a lesion in my right eye. Okay, and that was quite alarming. It was growing for a period of a month. So I had to resort to telemedicine even for that.
Right.
I had to send up an image by WhatsApp to my doctor, and then he advised me to my ophthalmologist, and he's advised me medication for that. So these are the adjustments we need to make. But I think by and large, I haven't faced too many issues. Being able to sort of fall in line with the adjustments that I needed to make.
Thanks, Vijay. Dr. Mangala, across the spectrum of persons that you have interacted with over the last, I guess, 2 months, what have been some of the common issues and concerns that you've come across? And you will have to unmute yourself.
Yeah, I think majority of the calls or the consultations were primarily to get refills for medication, because that was their major need. People who needed a prescription to get their refill. So those people who were on regular medication, that was their primary concern. Getting a refill for their medication was because they didn't have major issues that needed a immediate consultation. So they were quite comfortable getting a prescription, and they continued with their routine as before. It didn't have a major impact on them. But then when there was a discontinuation of medication, we have seen quite a number of people who were off medication for over 6 months or 8 months. They were doing fairly well till recently, but then I can't definitely say that the lockdown was responsible for the relapse. But then around this time, we have seen quite a number of people relapsing, primarily because of drug discontinuation.
Right.
So that is one thing that is, it becomes very difficult for the families to bring them to the hospital, right from transportation and getting them calmed down and keeping them restrained in their houses. All that became an issue. Other than that, I think we have seen a few people who have had an acute onset of psychotic illness during the lockdown, primarily people who have their jobs or who have been asked to work from home, and then there is they are not sure if they can get back to their jobs as before. All that financial insecurity and insecurity about retaining the job, all this has caused some people to develop an acute illness and come. By and large, I will say, I don't think many of our patients whom we see face to face in our clinics are seriously worried about COVID or the lockdown. No, okay. Ask them why they are wearing a mask. Most of the time, their response is the police will hit us if we don't. Or when we say don't enter the room without wearing a mask, that is one of the reasons they are using it. Beyond that, I don't think they are showing any major interest in why people are asked to wear a mask and isolate themselves.
Right. Okay, thank you. Mr. Mokashi, आपके बेटे को schizophrenia है, करीब 20 साल से है ना शायद?
Right. Yes.
हाँ, तो आप बता सकते हैं कि उनका पहले रूटीन क्या था और फिर कोविड की वजह से उनके रूटीन में क्या चेंजेस आए हैं और उसका क्या असर हुआ है?
And he has been going regularly to SA for last more than 6 years.
Okay.
And he lives at around, I used to drop him where the SA bus, you would pick him up at around 8:45, 9 o'clock. And then he would spend the entire day there. The activities there in SA were much to his liking. And I think Kadambari will be able to elaborate more on how they used to keep engaged all the people who were
Right.
coming there. And he would come back home at around 5:36, take a rest, then do a little bit of walk, and then he's very much interested in computer-aided design. He uses what? Corel Draw. Yeah, and he makes a lot of designs. He spends some time there.
Right.
Now, after the lockdown has been, I mean, he has taken it well, but the routine has a little bit changed. He is feeling not able to go to sleep on time in the night, and the activity having come down finds it a little more of time for him to sleep. So
Right.
we also don't pressurize him to get up early.
Right.
Slight increase in the sleep medicine which he has started taking. But I had a word with the doctor, who is Dr. Kulkarni. So he said that's all right as long as it doesn't increase the dose very much. Let him be comfortable.
Right.
But he has taken it well. And since we are in a senior citizen complex, we are not allowed to go out. Anyway, he has not been mixing with any of the seniors here.
Right.
But in between, he was a little uncomfortable. He wanted to go out and see the things. So it's with a great difficulty today we got permission to go to do a bit of a bank work. So I have taken him today. And things around, aren't very good, I would say, that though we were locked up for more than 60 days in our complex, going out, I didn't find things. I mean, people aren't maintaining social distancing.
Right.
And any one of the people suffering from such mental disorders are there, and they're going to find it very difficult managing people outside.
Right. Right.
So,
Okay.
and now the SA has started webinars at 11 o'clock in the morning, which he has been attending.
Right.
And I think they have set up a good routine now from 1st of June. They would be conducting yoga classes even at around 4:30 to 5. So
Okay.
with that, I think he is getting in touch with his old colleagues, which he has been doing for the last 6 hours, 6
Right.
years.
Right.
So now at least he's able to see them on live. So he's managing well, in fact, and he's taking a lot of interest in doing housework. And his mother was not well. My wife was not well in me.
Right.
So he has been doing a lot of small little work in the house.
Right. Thank you. Kadambari, would you like to share about the schedule that's so first of all, what is the kind of activities you'll offer or used to offer before the COVID times, and also what were the skills that you were enabling people who came there, the user survivors, to develop? I think you're on mute. You need to unmute. Should I unmute? Okay.
Yes.
Yeah.
Now
Okay.
it is here.
Yeah.
Okay, good afternoon, everyone, and thank you for Aparna for giving me this opportunity to share my thoughts regarding this situation. So before this lockdown, we used to have a schedule like 10 to 4:30. This is our rehabilitation center's timing, as Mokashi uncle said. and we engage them in various activities and supportive therapies like art-based therapies, dance movement therapies, and a few activities which some of them are income generating activities, some of them are like responsibility taking behavior उनका बढ़ जाता है, so that kind of activities, and to build up their confidence. So we work on these areas, and each activity has a therapeutic base particularly. So हम इन लोगों को ऐसे engage करते थे activities में, but due to this lockdown period, they are unable to come to SA.
Right.
So now we are offering online activities for them. In which, as Uncle said, we will be offering yoga session for 1 hour,
Right.
and other recreational activities, supportive therapies that I mentioned before also, that dance movement therapy, body movement therapy, art-based therapy, and some recreational activities.
Okay.
So all this, and about their skills, yes, they have improved on responsibility taking behavior, then improve their socialization,
Mm.
then their anxiety has been reduced nowadays.
Right.
And some of them, like 3 of them, are very stable, so we have given them job at our center.
Right.
So such kind of improvements we can see. They have improved their confidence.
Mm.
These things we have seen in these days.
Right. Thanks. Thank you, Kadambari. Vidya, coming to you, can you tell us about your sister and, where she was when the COVID-19 lockdown happened and how she's managing?
My sister was with me for until the last year. Now she's settled in Bangalore because she likes to be independent, tries to do her things on things on her own. During the lockdown, she was in Bangalore in my parents' place. Her onset was quite late. It was in 10 months, both my parents had passed away. We are 4 siblings, and she was the only caregiver with my parents. So she was in a full-time job until then. And suddenly we got a phone call from her workplace saying that she needs to be hospitalized. Something is wrong. And that's when we found out the intensity of her situation. Otherwise, she has always been independent and organized.
Right.
Now, that being said, so she always tries to be on her own. And what we do is we have a support mechanism because my relatives are also in Bangalore, and my parents' place is very near to my aunt and uncle's place. So what we usually do is we make sure that one of us are in touch with her, though we are always on phone call. We are always constantly on touch, either through WhatsApp or through phone. She personally goes, at least meets my maternal uncle as well as my maternal aunt on alternate days, things like that, so that she is in touch with us in person all the time.
Right.
So at the time of lockdown, yes, and she has also been responsible for my niece who has come from Baroda, who is doing her bachelor's degree in Bangalore.
Right.
So she has been taking care of all these responsibilities to a large extent on her own. So
Right.
during lockdown, my niece had already gone back to Baroda, so it was only Aruna who was around. So at that time, yes, it was a little, difficult, I can say, and a little scary also because, we could not move out of the house, things like that. So we were a little worried, though we are on WhatsApp calls and all that. She had all the supplies on time, which were needed for the 10 to 15 days for us to get adjusted, for her to get adjusted alone. Then what we did was to make sure that, she doesn't slip with the routine that she had already set. We used to ask her to call one of us up by the time she gets up, by 9 o'clock. We have a group, sisters group, may WhatsApp me, she has to give a hi. Otherwise,
Right.
one of us will call and, wake her up. And then afterwards, there are days, when she goes for a walk to my aunt's place, which is nearby, and my aunt has either a breakfast or a glass of milk ready for her. So
Right.
it happens to be an outing for her, and it is in a walkable distance. So as far as going out and coming back was not that restricted as far as Bangalore is concerned. So all these work for us. And that has been something that we have been working on. And she also took up few things like, she's always an outdoors person, but now when she's cooped up at home, it does trouble her. So she started teaching my niece, yoga through the WhatsApp calls, things like that. Evening sessions were there. So all these set certain routines, and then that also made us, because she was constantly in touch with us, that also made us, made it easy for us to keep a check on whether her ADLs, activities of daily living, was in place. So
Right.
that is something. And there has been, in this 60 days, there has been times when we had to take, the doctor's help, because she needed, the change in the dosage of medications, things like that, when things were really, getting to her, when she was not able to go out and meet people. All those times I've been constantly in touch with Karpagam ma'am as well as Padma ma'am to get things, fall into place so that she's okay and she is comfortable wherever she is. So
Right.
these are the things that have worked for us.
Right. Thank you, Vidya.
Thank you.
Karpagam, we also have a question around family members. So maybe you can share a bit about what you're observing in the challenges people are facing, because everybody is now cooped up at home. Um, you know, family members are not going out. The person with the mental illness is also at home for longer periods of time. So are you observing, or are you getting calls on challenges related to that? I think you're on mute.
Good afternoon, everyone. Many of the families keep reporting that usually their ward used to come and attend the daycare center every day, and they follow a regular routine. They used to come in the morning, do some work, get involved in some activities, then they go back by 4 o'clock or 4:30. But now
Right.
at home, they find it very difficult to manage. So they have to make them to wake up on time, so do work on time. So they're remaining most of the time they are being unproductive. So that is a main problem. I mean, the complaint from the family members part. Then other people, most of the patients, they do well with regular counseling, the support from managers. So with constant counseling, we give reassurance for them to take medicines or whatever it is. So as they couldn't come for regular follow-up and meet the person in charge, so the family members are finding quite difficult to manage the patients.
Right.
That they can't. Usually, we give an ADL charting for all the patients who attend the daycare or the OP along with the medication part. But now they are very difficult for them to follow the ADL because they can't go for a walk in the evening, mornings. They can't follow the task, whatever assigned task they couldn't make up. So that is the other thing. The main problem, the main challenge is the family is facing into getting the prescription of, as Dr. Mangala said, getting the prescription, getting the medicines on time. So that makes them more anxious and panicking.
Right.
So without medicine, our ward will get relapsed. That is a more anxious part in them. And then they're putting on weight. Many of the patients sitting at home, as it is, the patients with mental illness has many of them has a comorbid physical problems due to the weight gain. But now,
Karpagam, can you speak a little louder, please, or closer to the mic? Thank you.
so many of the families keep reporting that they gain a lot of weight sitting at home idle. So being unproductive, that is the main one of the worries.
Right.
And apart from that, many of them are. Sorry, 1 second.
Sorry, we lost your chain of thought. Sorry.
So then they want to see the counselors. All the thing is a problem for them. They can't come and see us once in a month. They used to come, but now they can't. So that is the main. Usually they don't listen to the family members. They listen more to the counselors or the case managers.
Mm.
But now it got stuck down, and that is the main problem they're facing.
Right.
The many, even the families, they used to call us and ask, "Ma'am, when can we come and meet you?" And more than everything, the patients who are attending the daycare centers, they keep calling us and asking when the scarf will open. We
Mm.
want to come and do some work.
Right.
So very serious about what is going around, getting the virus, and that. They're very concerned about coming to SCARF and helping us in the OP or engaging in some activities. So in
Right.
such case, we keep telling we'll wait for some time, we'll call you. And that is the main challenge we are facing now. And more than everything, we are getting a lot of demand for admissions also now.
Mm.
So either the patient is relapsing or so maybe the acute onset of illness. So they keep demanding more. We get more of requests for admissions. But we have to work out on that, how to manage, how to take in patients. So that is the main challenge we are facing currently.
Right. Right. Okay. Thank you. Thank you, Karpagam. Vijay, there's a question that's come for you, and maybe it links to my next question. So my question was, what are the top issues you have come across from your peer community? But there's also a question: were there difficulties in reaching doctors? So maybe you can kind of address both. You need to unmute yourself. Thanks.
Fortunately, what has happened is just around the period of the lockdown, when it was implemented, the Telemedicine Act had been put into place. Although
Correct.
maybe it was prompted to be rushed in because of what was happening in that period.
Right.
So, by and large, most of the doctors have been accessible over WhatsApp or phone calls or video sessions.
Mm.
So I don't think that has been a major challenge as such.
Right.
Uh, you people would be aware that there are a lot of COVID dedicated helplines for people living with mental illnesses also. So a person can pick up the phone and call up any of these helplines for help for managing any psychological issues. So that was another relief for people. So reaching the doctor per se wasn't a problem. I don't see that as an issue for our members and the community who I interact with. In the initial phase, as was shared by others here, getting hold of medication and these kind of issues was a problem because the supply chains were disrupted. But all that has evened out going forward, and even that is no more concern. We are
Right.
almost back to par. Now, specific to our peer community, what we are seeing is, in some cases there is an abrupt spike in symptoms. Yeah? So it might be from mild anxiety to depression or a state of confusion to something more severe needing immediate help.
Mm.
Okay. So, for instance, a person had to be hospitalized, say around a fortnight back because of self-harm instincts and such things. There have been cases of people overdosing on their medicines because of. See, I think nobody's attributing these kind of spikes in symptoms specifically to the lockdown, because I think they themselves cannot put a finger on what's prompting these kind of behavioral changes.
Mm.
But since all these symptoms and issues are cropping up at this juncture, it
Right.
does point to the overall stress that people are facing. That inability to manage these circumstances is driving them to this kind of behavior.
Correct.
Just a week ago, we had a person who experienced, who tried to experiment with, I would rather say, spiritual healing.
Mm.
And that intense experience escalated his symptoms to such a level that he hit psychosis, and a full-blown manic attack, right?
Mm.
And his caregivers were in touch with me, and they couldn't hospitalize him because of the fears of catching COVID and so on. And then
Right.
he had to be treated at home. So these issues are there. There is
Right.
no question about it. And I feel the younger lot are more vulnerable. I have been noticing. Maybe they are more accustomed to be, socializing more, and I think the level of maturity might be lesser. Their resilience is a bit lesser than as compared to people with a vaster lived experience. That's what I. And then
Right.
there are some minor issues that people report, such as disruptions in their daily routines and all that.
Right.
So I think that is manageable, and I think that's what everybody of us, each one of us is experiencing, not
Right.
only people living with bipolar disorder.
Right.
Yeah.
Okay. Thank you. Mr. Mokashi, there's a question that's come in for you. Are you comfortable with digital contact or your telemedicine with are you and your son both comfortable with telemedicine with the doctor or with the psychologist? Is that
So,
are you finding it effective as well?
uh, getting medicines for him has not been an issue so far because our pharmacist has uh, been able to give whatever was the prescribed medicine.
Hmm.
In fact, I developed another gentleman in Pune who could deliver medicines apart from my next door pharmacist because
Right.
we were not able to go and visit the pharmacist at all, even though he was just outside our society. Uh,
Right.
so, however, I have tried in the initial stages. In fact, I was under strength to have enough medicines for him stocked
Hmm.
at least for a month in advance. And I still continue to have that little bit of fear. So I'm going to stock at least for 2 months to start with. But
Hmm.
getting the medicines has so far not been an issue in Pune.
Right.
Hopefully, as somebody said, that the supply chain has been stabilized.
Hmm.
But I continue to have that kind of a fear in case certain medicine is not available because he is on medicines for schizophrenia, OCD, and
Hmm.
all combined scenarios the doctor knows best.
Right.
Uh, any one of that particular medicine not available, then what would be the how do I cope up with those kind of challenges? And these are the kind of questions have now started arising in my mind.
Hmm.
That a particular medicine is not available for some time or
Right.
for some months. What could happen, and how do we do that? We were not in a position to meet the doctor, but however, we were able to contact him on the phone.
Right.
Uh-huh. So these are some of the challenges that have come up more for the caregivers as well as for the patients.
Right.
So
Right.
I think over a period of time, we need to work on that.
Hmm.
Other point was that uh, SA has been the whatever these boys and the girls who are going to the halfway center at SA. Now we are experiencing the benefit of that when they are at home.
Right.
Uh, all this time we were not in a position to make that out because that was no challenge. So
Hmm.
to some extent, this COVID-19 has put a challenge that
Hmm.
how do they manage things. And so far, in case of my son, because in everybody's case, I think things would be a little different. But in so far, I feel that he has taken it quite positively. And
Right.
he maintains a good social distance, though he doesn't go out much,
Hmm.
wearing a mask or health hygiene is slightly. I mean, this is an issue with most of the mentally disordered people, making them wash hands often and things like that. But so far, so good.
Right. Right. And does he work? Does he help out in kind of
Yes,
the housework as
yes,
well?
yes. More than what you would have done, but because he is more at home. And
Right.
secondly, in between his mother wasn't well, so
Hmm.
he wasn't able to but he's doing that and without much probing. So
Right.
I thank
Right.
whatever background
Okay.
under which they have come.
Right. Right. Dr. Mangala, two questions for you. One specific to telemedicine. I think there's still, so I know that, while telemedicine is working for some people, people are not sure whether they can reach out to, because sometimes they've not seen a doctor for an extended period of time, like you said, maybe a couple of years or maybe even more. So, who do they reach out to? How do they reach out to? And second, is there also a requirement for so obviously the old prescriptions are not working, so do they need to get a fresh prescription, and how recent does that prescription need to be?
Well, in India, I think old prescription works for quite a few years till somebody suddenly wakes up and finds that the prescription is rather 5-10 years old. So those are some rare occurrences in this country. That is when people come to us after 5 years, we know that is only because the pharmacist has refused a prescription, not because they really wanted to consult the doctor in emergency, right? But just to add on to what Mr. Mokashi was saying, many families, out of fear that they may not be able to get medication, they tend to reduce the medication so that they will last longer. No, right? They are on 4 milligram of risperidone. They would decide to take just 2 milligrams so that the medicines last longer. Sometimes it's okay, it might help them, but then there are some people who do not tolerate even dose reductions, and then things become very difficult. So that is something people should do with caution and not do it without consulting their respective doctors. Coming to telemedicine, I think people who are already a part of a system where they are under the care of a psychiatrist or a team, they have absolutely, it is, I would say it's even seamless. They just have to make a call and connect and things fall in place. The bigger challenge is for people who are experiencing a psychiatric illness for the first time, especially when it is a family member. And I think psychiatry per se is a taboo area. People are not very keen about coming for a psychiatric consultation in the first place. And then they don't know the person. They are only talking to them over the phone. It is very, very stressful family also, because they are talking to a completely third person whom they are a stranger, to whom they are going to open up completely about their personal side. So that is a bigger challenge. So for them also, right now, telemedicine is the only option available, but then one personal face-to-face consultation followed by telemedicine definitely works better. Otherwise, just having a teleconsultation alone, it is sometimes difficult to build a rapport if there is no video conversation. If it is just a telephone call, it may not establish that amount of rapport, or maybe the doctor has to take an extra effort to reassure the patient and the family. And again, we are not very sure if we are getting all the information that we need when they are talking to us for the first time. A completely difficult situation to assess.
Right.
But I must say, we have been getting quite a number of new calls, especially in our COVID helpline, from all over Tamil Nadu, and we are following up some of them on repeat consultations as well. And now that it has become we have guidelines from the government, it is quite okay to use telemedicine for consultation. It definitely helps.
Right. Thank you, Dr. Mangala. Let's talk, I think, of one of the basic requirements that people are saying going forward, that you must wear a mask. And I know Dr. Mangala said that sometimes the only reason they're wearing a mask is because they say the police will beat me otherwise. Vijay, what is the feedback from the community on mask wearing? Is there a challenge? And you personally, I know cases where people with because you have asthma, and I know I think in Singapore, I know of at least one case that was reported where somebody with asthma was allowed to not wear a mask. She had to get a doctor's certificate because they find it very difficult. So that is one question. And Karpagam, to you, the follow-up question would be, how are you convincing, the patient community to wear masks? Because sometimes they won't listen to the family member asking them to. So starting with you, Vijay.
Uh, as far as the wearing of masks within our peer community, we haven't had any resistance to that. Okay. In fact, people are more sort of paranoid due to the news flow happening around them, and I don't think, and even violating the lockdown and all. Those issues have not really cropped up. So our community is not only consisting of people living with bipolar disorder, depression, and other mental disorders, but also caregivers. So otherwise, I would be getting that kind of feedback. To keep this person at home is a challenge or something like that. Coming to that aspect of wearing a mask, does it hamper me because I have acute asthma? Not at all. See, firstly, maybe it is because my asthma is very much in check because of my fitness and the regime that I maintain. And I don't think that should be a problem, especially with the typical kind of masks which we are wearing in India. These are the very thin masks through which it's easy to breathe. These are not the really heavy, the 3-ply or even heavier masks than those, which would sort of obstruct the flow of breath. So I haven't really experienced challenges on that front at all.
Right. Thanks, Vijay. Karpagam, from your perspective, have you had any calls from families kind of concerned about? You're on mute still.
From families, I've never received any phone calls saying that the patients are refusing to wear a mask. But when we some patients come walking to staff or some just for inquiry or some, so we keep telling them on the importance of wearing a mask to protect them from the virus and all.
Right.
So mainly we don't get any complaints because I think many people are aware a lot of through the social media and repeated users from the TV and other things.
Right.
Wearing a mask, whether they use it in a proper way or not is different. But everyone is using a mask nowadays, different forms.
Right.
Not any particular scientific mask, but chafe or sari or dupatta, something.
Right.
Many people are aware of, even though they don't have that seriousness of the virus, they are wearing them.
They're wearing the mask. Okay, great. Thanks. Kadambari, question for you. Somebody has asked about, you're talking of starting online yoga sessions as well. So does that help, user survivors who have chronic mental illness?
Yes, it does help for service users who are having chronic illness. It helps them to regenerate their mood. It helps them to calm down. So yes, it definitely helps them.
Right. Okay. Also, I think I know there was a little bit of discussion earlier on too much sleeping or lack of physical activity or eating too much food and so on. Again, what's working on this? What's not working? How are Mokashi and Vidya as caregivers? How are you supporting your family member on this? Mr. Mokashi, yeah, go ahead first.
As regards sleeping, it's not an issue as much.
Okay.
I have already discussed this with the doctor. So he said it's well within the parameters that he understands as regards my son.
Right.
Physical activity being less, yes, because being at home and though our society allows people to walk around the garden and the other areas.
Right.
Anand has been doing half an hour walk in the evening, but because of the heat outside, at times not much motivated to
Right.
do it.
Right.
As regards sharing of activities, as I said, in fact, it is quite more than what what we expected.
Good. Good. Okay.
Looking at things like that. So
Okay.
this is presently well within the
Right.
parameters that
Right.
we thought he would.
Great.
Get.
Okay. Thanks. Vidya, would you have anything to add to that?
Like the role of a caregiver, be it virtual as I am, or the one who is. I think it is much more challenging for a person who is living in that space,
Right.
because it's literally a tightrope walk all the time. And there are swings of moods, and you need to gauge every word that you say. It is quite challenging, especially when they are into intense conditions. Though when symptoms are under control, it is much more easier. So those are also the red flaggers that we notice, and the changes that we notice, and immediately get in touch with the doctors for the change of dosages that I have been telling you for these 60 days. So those were the red flaggers that I noticed. So it was the mood swings, the usual response that you get for certain things. You don't get it on those days. The let me call it the not so good days. Okay. So and sometimes this walk that we ask her to do, it might become an ordeal. So what we think is even if she goes to 3 to 4 days in a week, she does that. That would be a good week for us. Whereas not so good week if it is much lesser than that. So we are being pragmatic, and then something called as detached attachment. Maybe that is because of not living in physical space, though. She has been living here. I mean, when we had Chennai floods in 2015, she was very much here. As I told you, the intensity of her, her illness is not so much until and unless she undergoes psychosis. So, Karpagam ma'am can vouch for me, saying that, there have been times saying that, I'm not okay. I want to come to the, daycare center, stay there for a few days and come back. So those have been the way she has taken. So that has made our job very, very easy. So there is an awareness level, of course, when it was very severe, because the first few years, she was only on medications, ma'am. So when I talked to her psychiatrist, I felt, my God, she is lower. We lower the dose of medicine, and then these symptoms come back again. So that's when I said, see, I want something that that makes her. So that's where rehabilitation plays an important role as far as illnesses are concerned. So that has made her, strong enough to stay for all these 60 days, because I have seen her being scared to even go out and, meet new people. So when it was very severe, as I told you, the onset was when both my parents passed away. And all the three, we are 4 siblings, all the 3 of us were married. So none of us were around at that time. So at that time, it was a huge change for all of us. So those are the things that makes us, and that kind of awareness comes only through rehabilitation, nothing else. So that is something that we have to keep on doing, and that seems to have worked for us.
Right. Okay, I'm conscious that we have a lot of questions coming in. Guess there's a couple of questions, Dr. Mangala. How do we, if we assume that if the assumption is that 60% of the population will get COVID, we must also assume for the risk that even someone with a mental illness, who's being treated with medications will also get COVID. So what do we need to be prepared for, or what do the families need to prepare for that scenario? As well as, if you're, do you need to prepare for things like isolation? Do you need to prepare for medically how to handle that? What should the what should the preparation be for that?
I don't think it should be any different from what you would prepare for someone who doesn't have a mental health problem. The only issue here will be in case this person tests positive and has to go to isolation.
Right.
Yes, isolation can be a little testing for them. What needs to be ensured is nobody tries to stop the regular medication that he is on. As long as they're going to do that wherever he is in isolation, and treat him generally like they would treat him at other times. I don't think it is in any way different from handling a person with COVID, but who doesn't have a mental health problem. I think I completely agree with Mr. Vijay and Vidya. I think there is a lot of resilience in these people. Those who have overcome the illness and come out of it, I think they are generally game and they would be able to handle these things quite well. We don't unnecessarily worry. But the first and foremost thing is they are not in any way different from others when it comes to COVID. I think many a time people who are in institutions or people who are much lesser risk of getting a COVID-19 infection than others who don't respect rules, who don't wear masks, who are all the time on the streets. They are definitely much more, they run a bigger chance of catching an infection than many of our patients who are mostly homebound.
Right. Thank you.
I would just like to add one thing here. I think many of our patients are very keen about coming back to their regular activity, like Karpagam was saying. They are restless about staying at home. At the same time, they are also they are quite aware that this is likely to continue for some time, and they are ready to wait patiently as well. Though we do see them in the OP, and so I don't think a person with a mental health problem thinks any differently from a person without a mental health problem. I think they understand things as well as others, and sometimes they are able to accept these kind of difficulties because they have seen worse things in their lives. Support that Mr. Mokashi and Ms. Vidya highlighted, I don't think without that, many of our patients will not be doing so well. Hats off to all those families who are handling it so beautifully, lockdown or no lockdown.
Right. Thanks, Dr. Mangala. Karpagam, what are there's a question that's come up saying that, how can caregivers what guidance can you give to caregivers so that they don't get burnt out? Do you have anything that you'd like to say for that?
During this lockdown period, I think the burnt out will be only for those caregivers, for the patients who were attending some daycare center, or now they have to, the whole day they have to spend with the families. So, but we keep telling them, we just call the patients and tell them to just engage them with some activities, involved in some household works to help the parents, to support them, be a good support to them. So in such way we counsel the patients.
Right.
But nothing very. Some patients, as I said you earlier, there are some patients who refuse to take medicines and all at times.
Right.
So they are very, very difficult for the families to convince them and take. So they need some professional assistance at that time. That is one problem they report. And other than that, keeping them engaged, that is the main problem for them to face.
Right. Right. Okay. Thank you. And Kadambari, on that, I know when we were talking before, you said that sometimes you think that the families need not be so anxious. Do you want to talk a little bit about that?
Yes, being a caregiver of a person with mental illness, it is very much necessary for a caregiver to keep themselves emotionally fit. So how they keep themselves fit? So try to spend quality time with each other. Try to involve our loved one with some conversations. You can play some indoor games with them, like playing cards, carom, chess, etc. Or you can give them some responsibilities so that they can involve in those things. And you can do yoga exercises, breathing exercises with them. So it will definitely help them also, as well as you also, to reduce your anxiety, fear, or stress. So
Right.
there are a few things which you can do at your home with your loved ones.
Right. Thank you. Thank you. Dr. Mangala, quick question. Are persons with mental illness more prone to the COVID-19 infection?
That is a difficult thing to say because we have not, personally, I have not seen anyone with a serious mental illness coming with COVID-19. But technically, they are not very different from the rest of the population, except when they are on certain specific medicines which can reduce their immunity levels. Like if they are on medication like clozapine, then there's a possibility that they can have a drop in their immunity levels, which can make them a little more prone. But I think that is, I'm just speculating there. We have not seen any case reports of people on clozapine catching COVID-19 infection. And other than that, I think if a person is stable with no major psychotic symptoms at the moment, which is affecting his self-care, which is making him careless, if that is not there, I don't see any reason why he or she is going to be more prone for COVID-19 than others in the family.
Right, right. I guess the only point I would like to say is if they do have comorbidities like, hypertension or asthma or diabetes, then I don't know if the risk is higher in those cases.
Yeah, again, the risk would be higher if they have hypertension or diabetes or a chronic obstructive lung disorder. But then it is not the mental illness that is contributing to their
Correct,
COVID.
correct. Okay, thanks. So there's a question, are there challenges in admitting people at the moment if there is a relapse and, they need to be admitted into a hospital? Under the current circumstances, are there issues with that or?
Yes, there are quite a few challenges when it comes to admitting patients, primarily because there is no transportation available and not many ambulance services are willing to offer to pick up a person with a serious mental health problem, primarily because they have to get close to him, restrain him, and put him into the vehicle. So the families are having a tough time bringing people to the hospital.
Right.
There are very few centers right now who are offering that kind of a service where they are willing to come and pick up the person and admit them in the hospital and offer acute care. That will be for a fee. It is not very cheap, and it comes with a price. But right now, I think when things are improving, admissions into institutions for relapses should not be a problem. As long as there is facility to isolate the person in case there is a possibility of this person catching an infection. That is the challenge. So, and since we don't have testing facility before admitting every individual into an institution, we are running a risk of exposing other people in the facility to a COVID-19 status. That is the only challenge that hospitals will be facing, provided they don't have, if they don't have a isolation facility.
So just on that, to clarify, because I thought all hospitals at the moment require before admission at least a COVID test. You're saying that at the moment that's not required for...
No, that is not possible simply because there is a paucity of kits available. So labs are reluctant to do it unless there is a genuine reason why we are asking for the test. There has to be a history of fever or some symptom related to COVID, without which they are not ready to do the test because they feel it is a waste of a valuable kit that will be necessary for a person who's definitely COVID positive.
Right. Okay. Couple of, I think we've already answered. There's a question on shortage of medicine and, should we stock a little bit extra? I think we've already addressed that at the moment. I know initially there were some issues right in the very beginning, but I think of late we haven't heard. And, any panelists would like to add to that, and any guidance on how much you're asking your patient community to stock as medicine typically.
If I can reply to
Sure.
that question,
Sure.
what we experienced was specific drugs were at given points of time were difficult to source, especially anti-anxiety medications. Okay?
Right.
So if somebody is used to a particular brand of medication with a unique combination and for which there is no alternative available, for a long period they were not available. I am not very sure if that situation has been resolved to any degree yet. This could have also been because people were hoarding medications, right? Like even some of the panelists here have shared that people are buying medicines for 2 months at a stretch, to be secure. So that could have also contributed to the shortage.
Right.
And of course the supply chain disruption. So in particular, anti-anxiety medicines is one issue that I have heard often from our community members.
Okay. Dr. Mangala,
I think
anything
there is
on
a
that?
risk of abuse. Yeah, there is a risk of abuse if anti-anxiety medicines are too freely available. And the risk of overdosage is also high if people are going to store too much of medication in their houses. But generally, we as consultants, what we do at SCARF is we do give a prescription for a couple of months, 2 or 3 months, simply because we don't want them coming back to the hospital repeatedly and get exposed. So the prescription can be for 3 months, but then you can always take your refill every month from the pharmacy. So that could still work. And I don't think there is a problem in getting medicines anywhere in the country now, at least as far as Chennai, I can vouch for that.
Right. Thank you, Dr. Mangala. Just one question, I think, to both Kadambari and Karpagam. There obviously there is a social interaction when the service users are coming in regularly, and what are you seeing as the impact of this lack of social interaction? And do you see an issue when the time comes for them to start coming back? Will they have a problem getting back into that routine? So, those who come to, say, daycare centers or who come for regular follow-ups, etc. So, Kadambari, do you see that as an issue, and what's the feedback you're getting? And do you see as an issue when they have to start coming back?
As per my knowledge, we are trying to make them communicate with each other by doing conference calls and all. So I don't think so. For our service user, there will be a issue of rejoining our center because they are very eager to rejoin the center.
Right.
I think so. There will be an issue to rejoining our center.
Okay. Karpagam, anything that you would like to add to that?
In our daycare center, we have 2 sets of people who volunteers themselves and come and keep them engaged fully in our center. There are some people who want to come, who are forced to come.
Right.
They want to just get rid of them. They come to just go out of the house and spend some time mixed with other people. So the category of people who come with the full push from the family, they may refuse to come now.
Right.
They get a long break now. So it will be very difficult for them to convince them and send them back to the rehab centers. The other set of people who always volunteers and want to be engaged, they are very much eagerly waiting to come for the rehab center. They are already doing a lot of work at home, a lot of handicrafts, as I told you that thing.
Right.
Themselves a lot of doing handicrafts items. Everything sitting at home, they are doing our instructions.
Okay, thank you. I think we've kind of exceeded our time, so I'd like to wrap up. I'd just like to ask, first of all, I think I'll start with Mr. Mokashi and Vidya. What is your kind of one sentence advice to, family members listening out there? So, Mr. Mokashi, you want to start?
Uh, it's quite a challenge, even otherwise, than having a person with a mental disability at home. Uh, during this period, more than the person with a mental disability, the caregiver is equally at a tensionous point on many other areas. One is the COVID infection, economic viability, and continuing how to treat the patient in future. Mainly also arising out of the there is no medicine at the moment for the COVID, so we don't know really how long this is going to last. So this does affect most of the caregivers. So keeping in touch with people with positive ideas, and we are fortunate that we are having SA as a background under which they keep
Right.
us taking things. So having an institutional support in these times would definitely help most of the families.
Right. Right. Thanks, Mr. Mokashi. Vidya, do you have anything to kind of, your word of advice?
Taking one day at a time, and I would reiterate whatever Mr. Mokashi has told. Yes, it is a challenging task. I think taking one day at a time, one incident at a time, would make it much more comfortable for us as caregivers to be strong and move on. Letting go of it then and there and moving on, I think, seems to be the only way forward. That is from my perspective. Yes.
Right. Thank you.
Okay.
Thank you.
Thank you.
Kadambari, what's your, and, what is SAR doing a little bit over the next couple of, you said you're starting next month some activities. So if you can just quickly let people know where they can find information on that, and also, what's your advice to families out there?
Yes, we are extending our online activities for those who are not a member of SA. So anybody from other states, countries, they can also join our online activities. And you can get information on our Facebook page and our website also.
Right.
You can go through it and enroll yourself for these online activities. And my last word for caregivers, don't nag so much to your loved one. Give them space. And if anybody doesn't want to do any activity or anything, so let it be. Don't force him or her to do that activity at that point. And make them feel important by doing simple things like make some dishes, their favorite dishes, or sit with them, ask their choices, involve them in your decisions. So kind of things you can do to make them better and give them some hope that you can do planning, that we can plan some trip, or we can go out to watch movie after the lockdown will get over. So it will give them some hope that things will be fine after a few days.
Right. Thanks. Karpagam, your advice?
All advice. Don't get panic. So, so live your life, enjoy your life.
Right.
Stop
Thanks.
watching on COVID too much. That's it.
Stop watching, sorry?
Views on COVID.
News. Yes, agreed. Right. Vijay, from you? You're on mute.
Sure. Without a shadow of doubt, this is the biggest crisis that I have seen in my lifetime. So the repercussions are not just in the immediate, but we'll be facing them in the times to come also. The repercussions will be on the economic front also. But like during every single crisis that we have faced, we develop coping mechanisms, we learn to overcome them. So
Right.
there is always hope from that. With every crisis comes an opportunity also. How can we build on this to grow from this? That's my message to everybody here. I'm
Right.
sure there will be ways that you can find to deal with it. Yeah.
Sure. Thanks, Vijay. And Dr. Mangala?
I think first I must thank COVID, because COVID has definitely changed the way people look at mental health. Earlier, it was like it happens to somebody else. It doesn't happen to me. And I think after COVID, everybody realizes any one of us is prone to develop a mental health problem, big or small, at some point in our life. And that is a major lesson that COVID has taught most people. And the only thing that I would like to say here is, if you think you need help, please don't hesitate to ask for help. There are people out there, there are services available, and there is a support system. Unless you ask people from me.
Correct.
Thank you for this opportunity.
Thank you, Dr. Mangala. And I think I would like to just quickly thank our participants, panelists, first of all. So thank you, Dr. Mangala, Karpagam, and Vidya, and thank you, Scarf, and thank you, Sa, as well, and of course Vijay from Bipolar India as well. And I guess
Thank you, Aparna.
yeah. All right. I think it's been a great. God, there's so much echo now. Okay. This been really a useful session. So I think most people would have benefited a lot from it and can refer to this as they go along. And thank you to all the attendees and for your questions and for participation. I think it always helps when we have active participants and people are asking questions. So thank you all.
Thank you.
Stay safe. Yeah.
Thank you, everyone.
Thank you, Mr. Vijay.